नमस्कार दोस्तों, स्वागत है आप सभी का आपका और हमारा YouTube चैनल नर्सिंग कैरियर क्लब में। दोस्तों, हमें उम्मीद है कि आपने हमारा पिछला वीडियो जरूर देखा होगा। यदि किसी कारणवश नहीं देख पाए हैं तो दिए गए डिस्क्रिप्शन बॉक्स के लिंक पे क्लिक करके जरूर देखें। दोस्तों, अगर आपको हमारी वीडियो पसंद आता है तो इसे लाइक, शेयर एवं सब्सक्राइब करना ना भूलें। तो आइए दोस्तों, आज हम बीएससी नर्सिंग थर्ड ईयर का चाइल्ड हेल्थ नर्सिंग सब्जेक्ट का यूनिट 4 डिस्कस करते हैं। यूनिट 4 का नाम है इंटीग्रेटेड मैनेजमेंट ऑफ चाइल्डहुड इलनेस, which is commonly known as IMNCI. इसके ऑब्जेक्टिव्स निम्न प्रकार है, like what is IMNCI, which is discussed in slide number 4 to 5. Second, explain about IMNCI strategy, which is discussed in slide number 6 to 7. Next, explain about essential components of IMNCI strategy, which is discussed in slide number 8 to 9. Next, describe the IMNCI clinical guidelines, which is discussed in slide number 11 to 12. Next, explain the principles of integrated care, which is discussed in slide number 14 to 20. Next, list out the IMNCI case management process, which is discussed in slide number 21 to 28. So, now let's discuss about IMNCI. So if we talk about introduction, then we can see that every year more than 10 million child die in developing countries before they reach their 5th birthday. According to National Family Health Survey third, in India, the common illness in child younger than 5 years of age include fever like acute respiratory infection, diarrhea, malnutrition, and often combination of these conditions. So, this evidence suggests that a more integrated approach to manage sick children was needed to achieve better outcomes and reduce mortality in children. So, integrated approach means integrated word means combined. So, simply one approach was unable to solve this problem in India. That is why integrated approach was needed to manage these sick children so that we can reduce their mortality rate or morbidity rate. Now let's discuss about IMNCI strategy. So IMNCI strategy developed by WHO. It was developed by WHO, that is World Health Organization, in collaboration with UNICEF and many other agencies in mid-1990s. This combines improved management of common childhood illness as well as prevention of disease and promotion of health by dealing with counseling on particularly feeding and immunization, because these two are the vital aspect that will determine the health of the newborn baby. If there will be well breastfeeding and if there will be well established immunization, then the disease ratio will be much more reduced in comparison to without immunization or without proper breastfeeding. So this strategy has been adopted and expanded in India to include neonatal care at home as well as in the health facilities, and it is renamed as IMNCI. So now let's see about essential components of IMNCI strategy. It includes three main components. First, improvement in the case management skills of health staff through use of locally adapted guidelines. Second, improvement in overall health system. And third, improvement in family and community health practices. Now let's see our practice question number 1. So our first practice question is IMNCI was developed in mid-1975, mid-1980, mid-1985 and mid-1990s. So our answer is option D, mid-1990s. As we had already discussed in slide number 7 that integrated management of childhood illness strategy was developed in mid-1990s. So now let's see about IMNCI clinical guidelines. So particularly it targets children less than 5 years old, and the following guidelines represents: first, an evidence-based syndromic approach to case management that includes rational, effective and affordable use of drugs. Next guideline represents careful and systematic assessment of common symptoms using well-selected, reliable clinical signs. And third guideline represents helps to guide rational and effective actions. Now let's see our practice question number 2. So our second question is IMNCI guidelines are based on: first, evidence mixed approach. Second, evidence biased approach. Third, evidence based approach. And fourth, evidence fixed approach. So our answer is third option, evidence based approach. So as we had already discussed in slide number 12 that the guidelines represents an evidence based approach. Now let's see the principles of integrated care. Here are the principles. So it focuses on children up to 5 years of age, and the treatment guidelines have been broadly described under two categories, that are young children age up to 2 months and children age 2 months to 5 years. They have categorized the treatment guidelines into two categories. First is young children age up to 2 months and from 2 months to 5 years. So these are based on the following principles. Following are the principles of IMCI guidelines. So first principles, all children under 5 years of age must be examined for conditions which indicate immediate referral. So all the children under 5 years of age should be examined for all the conditions and should the conditions which indicates for immediate referral. Second principles, children must be routinely assessed for major symptoms, nutritional and immunization status, feeding problems and other problems. Next, only a limited number of carefully selected clinical signs are used for assessment. Like classification are color coded and suggest urgent pre-referral treatment and referral treatment. Initiation of treatment in health facility like specific medical treatment and advice, yellow, or simple advice and management at home, that is green. So in diagram you can see the color coding. So in this, green indicates simple advice on home management and yellow color indicates specific medical treatment and advice, and this pink color suggests urgent pre-referral treatment and referral. So with the help of this color coding, we can classify the conditions likewise. Next principle, IMNCI guidelines address most common but not all pediatric problems. And IMNCI management protocols use a limited number of essential drugs. Next principle, caretakers are actively involved in the treatment of the children, and IMNCI includes counseling of caretakers about home, including feeding, fluids, and when to return to healthcare facility. Now let's see about IMNCI case management process. So IMNCI management process includes the following approaches like assess the young infant or child, second, classify the illness, third, identify the treatment, next, treat the young infant or child, next, counsel the mother, and finally provide follow-up care. So you can see the flow chart here. For all sick children is up to 5 years who are brought to the first level health facility, assess the child, check for danger signs or possible bacterial infection or jaundice, ask about main symptoms. If a main symptoms is reported, assess further, then check nutritional and immunizational status and also check for other problems. After that, classify the child illness like we had discussed earlier the color coding. So use a color coded triad system to classify the child's main symptoms and his or her nutritional or feeding status. Then, if urgent referral is needed and possible, identify urgent pre-referral treatment like needed for the child classification, and if no urgent referral is needed and possible, identify treatment needed for the child classification, identity specific medical treatment and or advice. So if urgent treatment is needed, then treat the child, give urgent pre-referral treatment as needed. And if urgent treatment is not needed, then give the first dose of oral drugs in the clinic and or advise the child caretaker. Teach the caretaker how to give oral drugs and how to treat local infections at home. If needed, give immunizations. And if urgent care is needed, then refer the child, explain to the child's caretaker the need for referral, calm the caretaker's fear and how to resolve any problems, write a referral note, give instructions and supplies needed to care for the child on the way to the hospital. And for not emergency condition, counsel the mother, assess the child's feeding, including breastfeeding practices, and solve feeding problems if present, advise about feeding and fluids during illness, and about when to return to a health facility. Counsel the mother about her own health. So, and finally, follow-up care. So give follow-up care when the child returns to the clinic and if necessary, reassess the child for new problems. Now let's see about the integrated case management process. So for this, outpatient health facility. After that, check for possible bacterial infection or jaundice. Then assess for the symptoms like diarrhea. Then check for feeding problem or malnutrition and immunization status. Then check for other symptoms. Then classify conditions and identify treatment actions according to color-coded treatment charts which has been already described earlier. Then three conditions will be arise. The color coding will show three conditions whether it is pink or yellow or green. If it is pink, then urgent referral is needed. If it is yellow, then treatment at the outpatient health facility, and if it is green, then home management. So first let's discuss about pink, that is urgent referral. In this outpatient health facility, pre-referral treatments advise parents and refer young infants. In yellow, treatment at the outpatient health facility. Outpatient health facility includes treat local infections, give oral drugs, advise and teach caretaker and follow up. So in green, home management, caretaker is counseled how to First, give oral drugs, then treat local infections, then continue exclusive breastfeeding, then keep the young infant warm, and when to return immediately and follow up. If it is pink, then referral facilities like emergency trials and treatment, diagnosis, treatment, monitoring and follow up. So our third practice question is IMNCI guidelines mainly focus on first option children up to 7 years of age, second children up to 5 years of age, third children up to 10 years of age, and fourth children up to 15 years of age. So the correct answer is option B, children up to 5 years of age. As we had already discussed earlier in slide number 15 that IMNCI guideline particularly focuses on children up to 5 years of age. So with this we have completed our topic IMNCI. So दोस्तों अगर आपको हमारे वीडियो से रिलेटेड कोई भी अगर आपको हमारे वीडियो से रिलेटेड कोई भी कंफ्यूजन है तो आप डिस्क्रिप्शन बॉक्स में जाके हमें कमेंट कर सकते हैं। थैंक यू।